Most people believe a heart attack arrives without warning. One moment you're fine, the next you're on the floor. But after more than 30 years of practicing cardiology, I can tell you something that might genuinely surprise you. The most dangerous heart attack we know of, the one doctors quietly call the widowmaker, almost always sends signals before it strikes. Sometimes 2 weeks before, sometimes longer. And the reason it's so deadly isn't because it comes out of nowhere. It's because the warnings it sends look so ordinary, so easy to brush off, that almost no one recognizes them until it's too late. Hello, and welcome. I'm Dr. Edward Collins. Over the course of my career, I've cared for thousands of patients living with heart disease, and I've sat across from far too many families who told me afterward, "He mentioned something felt off, but we didn't think it was serious." That sentence haunts me, because in nearly every case, there was a window, a real, measurable window of time where something could have been done. And today, I want to walk you through that window, what to look for, what it feels like, and what to say if you ever find yourself in it. Before we go any further, let me ask you something. Have you ever climbed a flight of stairs and noticed yourself a little more out of breath than usual? Not gasping, not collapsing, just slightly more winded than the last time you did it. Or maybe you felt a strange tightness in your jaw while doing the dishes, and it passed in a minute or two, and you forgot all about it. If you've ever had a moment like that, I want you to keep it in mind as we go through this, because those small, dismissible moments are exactly what we're going to talk about. Let me tell you about a patient I'll call Robert. Robert was 62. A retired electrician, in reasonably good shape, no major health problems other than slightly elevated cholesterol. About 10 days before he came to see me, he started feeling tired walking up the stairs in his own home. He'd lived in that house for 28 years. He'd climbed those stairs maybe 40,000 times, but that week, he had to pause halfway up. He told his wife it was probably just the heat, or maybe he hadn't been sleeping well. 2 days later, he felt a burning in his throat while sitting in his recliner watching the news. He took an antacid. The next morning, his jaw ached for about 15 minutes while he was shaving. He thought maybe he'd slept on it wrong. By the time he came into my office, almost reluctantly because his wife insisted, we ran an imaging study and found a critical blockage in his left anterior descending artery. 95% closed. Robert was, quite literally, days away from a widowmaker heart attack. We were able to intervene. He's alive today. But what stuck with me was something he said as he was leaving the hospital. He said, "Doc, my body was telling me for 2 weeks. I just didn't speak the language." So let's learn that language together. To understand why this particular heart attack is so feared, you need to understand a little about the heart's plumbing. Your heart has 3 main arteries that supply it with blood. One of them, the left anterior descending artery, we call it the LAD, supplies blood to the front and largest portion of the heart muscle. It's the main highway. When that highway gets completely blocked, the front wall of the heart loses its blood supply almost instantly, and the heart can go into a fatal rhythm in as little as 90 seconds. That's why it earned its grim nickname. Research suggests that without immediate medical intervention, the survival rate is devastatingly low, somewhere around 12%. But, and this is the part I want you to hold on to, when the warning signs are recognized early and the blockage is treated before the artery fully closes, survival rates climb to over 95%. The difference between those two numbers is not luck. It's awareness. Now let's get into the 7 warning signs. I want you to listen carefully because most of these will sound almost too ordinary. That's the whole problem. The first sign is unusual fatigue when climbing stairs or walking uphill. Not the normal, "I'm getting older" kind of tiredness. I'm talking about a noticeable change. Stairs that didn't bother you a month ago suddenly feel like a workout. You find yourself pausing at the landing. You feel a heaviness in your chest or legs that wasn't there before. Here's why this matters.
When the LAD is becoming narrowed, your heart can still pump enough blood at rest, but the moment you demand more of it, say by climbing stairs, it can't keep up.
That fatigue is your heart whispering that something is wrong. Over time, if ignored, the narrowing usually progresses until the artery closes completely. What to do instead of brushing it off? Pay attention to changes. If stairs felt different this month than last month, that's worth a conversation with your physician. The second sign is jaw or neck pain that comes and goes. And here's where it gets interesting. Most people associate heart problems with chest pain, but the nerves that carry pain signals from the heart actually share pathways with the nerves in your jaw, neck, and upper back. So when the heart is in distress, the brain sometimes interprets that signal as coming from elsewhere. Patients describe it as a dull ache along the jawline, sometimes on the left side, sometimes both. It might last a few minutes and disappear. It might happen during mild exertion or even while resting. Dental issues can certainly cause jaw pain, and I'm not saying every ache is cardiac. But if the pain comes and goes in a pattern, especially with activity, and your dentist can't find a cause, please don't stop investigating. The third sign is a burning sensation in the throat, especially at rest. This one fools almost everyone because it feels exactly like heartburn. In fact, many of my patients have spent weeks taking antacids before realizing the burning wasn't coming from their stomach at all. The clue is timing. True acid reflux is usually triggered by certain foods, by lying down, or by overeating. Cardiac-related burning often appears out of nowhere, sometimes while you're simply sitting still, and may be accompanied by a vague unease you can't quite name. If antacids aren't fully resolving it, or if the pattern doesn't fit your usual reflux, that's a signal to dig deeper. The fourth sign, and this one is especially important, is cold sweats during ordinary activity. Not the sweat of a hot day or a brisk walk in summer. I'm talking about breaking out in a clammy, cool sweat while doing something completely mundane, folding laundry, carrying groceries from the car, walking the dog at a normal pace. When your heart is struggling, your nervous system kicks into a stress response, and one of the earliest signs is that cold, damp feeling on the forehead, the upper lip, or the back of the neck. Most people don't realize how telling this symptom can be. If you find yourself wiping sweat off your brow during activities that never used to make you sweat, take it seriously. The fifth sign is shortness of breath after light tasks. This is closely related to the first sign, but it's distinct enough that it deserves its own attention. You might notice it when you're simply walking from one room to another, or after bending down to tie your shoes, or after carrying a light bag up a short walkway. The breathlessness comes on faster than it should and takes longer to resolve. Here's what's happening. When the LAD is partially blocked, the heart muscle can't pump efficiently, which causes a backup of pressure into the lungs. That pressure makes it harder for your lungs to do their job. You may not even feel chest discomfort, just that strange, unearned breathlessness. The sixth sign is mid-back pressure. This one is particularly tricky because so many people in their 50s, 60s, and 70s have back pain from arthritis or old injuries. But cardiac-related back pressure feels different. Patients describe it as a deep, squeezing or aching sensation between the shoulder blades, often without a clear physical cause. It doesn't get worse when you twist or stretch. It doesn't respond to your usual back remedies, and it tends to come on with exertion or emotional stress and ease with rest. If you've developed a new pattern of mid-back pressure that doesn't behave like your regular back pain, please mention it to your doctor. The seventh sign, and this one surprises many of my patients, is unexplained anxiety in the evening. I had a patient, a 68-year-old woman, who told me she'd been waking up around 10 or 11 at night with a sense of dread for nearly 2 weeks before her diagnosis. She thought she was developing an anxiety disorder. In reality, her heart was beginning to struggle, and her body was sounding an alarm she didn't recognize. Research suggests that subtle changes in heart function can trigger the nervous system to produce a feeling of unease, restlessness, or impending doom,
often in the evening hours when the body is winding down. This doesn't mean every anxious feeling is cardiac, but if this is new for you, if it's persistent, and if it coincides with any of the other signs we've discussed, it deserves attention. Now, before we go further, I want to pause on something critically important.
Women experience these warning signs differently than men, and research suggests they are misdiagnosed roughly 50% more often. Women are less likely to have classic chest pain and more likely to experience fatigue, nausea, jaw pain, back pressure, and that evening anxiety I just described. Their symptoms are often labeled as stress, menopause, indigestion, or panic attacks. If you're a woman watching this, or if you have a wife, sister, mother, or daughter in your life, please share this information. The warning signs may be quieter, but they are no less serious. Let me share one more story. A patient I'll call Margaret, 71 years old, came to see me after months of what she thought was acid reflux and getting older. She'd been waking up at night feeling vaguely uneasy. She'd noticed she got tired carrying her grocery bags into the kitchen. She mentioned, almost as an afterthought, that her jaw had been bothering her on and off. Her primary care doctor had treated her for reflux and recommended she try to manage her stress. By the time she sat across from me, she had 3 of the 7 signs we just discussed. We ran a stress test, followed by imaging, and found significant narrowing in her LAD. She had a procedure to open the artery, and within a few weeks, she told me she felt better than she had in years. What struck her, she said, was realizing how long she had been adjusting her life around symptoms she'd been told were nothing. She had stopped taking the stairs. She'd stopped carrying her own groceries. She'd been shrinking her world to accommodate a problem that was treatable. Now, you may be wondering, is there anything I can do at home to get a sense of my heart's condition? There's one simple, informal test that cardiologists sometimes mention, and research suggests it correlates reasonably well with cardiovascular fitness. It's the 4 flights of stairs test. If you can climb 4 flights of stairs, roughly 60 steps, in under a minute without stopping, without severe breathlessness, and without significant chest discomfort, that's generally a reassuring sign. If you can't, or if doing so produces any of the symptoms we've discussed, it may indicate that your heart isn't getting the blood flow it needs during exertion. Now, I want to be clear. This is not a diagnostic test. It's not a substitute for medical evaluation. And please do not attempt it if you have known heart disease, severe arthritis, balance issues, or if your doctor has advised against strenuous activity. It's simply one informal data point you can discuss with your physician. So let's talk about what to actually do. If you've recognized one or more of these signs in yourself over the past several days or weeks, here is my advice. First, don't panic. But don't dismiss it either. Schedule an appointment with your doctor as soon as reasonably possible, within days, not months. Tell them specifically, in plain language, what you've noticed and when. Use the word new. New fatigue on stairs, new jaw discomfort, new sweating with light activity. The word new carries weight in medicine. Second, if you experience any of these symptoms suddenly, severely, or in combination, especially chest pressure with shortness of breath, sweating, and arm or jaw pain, do not drive yourself anywhere. Call emergency services. And when you arrive at the emergency room, here is what I want you to say. Say these exact words. I'm concerned I may be having cardiac symptoms consistent with an LAD blockage. I would like an EKG and cardiac enzyme tests. That sentence will not be ignored. It tells the medical staff that you understand what's at stake, and it ensures you receive the appropriate workup quickly. Third, in the meantime, focus on the things that support heart health every single day. Move your body gently and consistently. Eat foods closer to their natural form. More vegetables, more fish, fewer processed items. Stay hydrated. Manage your stress as best you can. Get your sleep.
Take your medications exactly as prescribed. These aren't dramatic changes, but in some cases, they are exactly what tips the balance in your favor. I want to leave you with this. The Widowmaker has earned its frightening name because of how it ends. But the truth is that its story usually begins quietly. It begins with fatigue you blame on age, with heartburn you blame on dinner, with a tight jaw you blame on stress. The reason this video matters is not to frighten you, but to give you back something many people don't realize they have: time. Time to notice. Time to act. Time to walk into your doctor's office before your body forces the conversation in a way no one wants.
You don't need to live in fear of your heart. You just need to listen to it. And now, you know what it's trying to say. Take care of yourself. Pay attention to the small signals. Share what you've learned today with the people you love. And if something doesn't feel right, please trust that feeling and let someone help you sort it out. I'm Dr. Edward Collins, and I'll see you in the next one.